This morning you would have heard the talk on hyperhidrosis. This is a very common indication, and we have many patients every year that visit the clinic for treatment of excessive sweating under the armpits, on the forehead, on the palms, and on the feet. By far the most common treatment of excessive sweating undertaken is that of axillary hyperhidrosis, or underarm sweating. So I've prepared this video in order for you to understand the techniques used to inject the underarm area. To do the underarm hyperhidrosis injection, we would normally use a dilution of 5 mils of saline, bacteriostatic saline, to 100 units of Botox. I'm using Allergan Botox. If we use this dilution, we would administer a total of 2.5 mils in each axilla. And as a result, that would be giving a dose of 50 units per axilla. This is normally quite sufficient to induce around about an 80% to 90% reduction in most individuals of the sweating they experience in their underarms, which is why this treatment is a well-loved, successful option for those who suffer with hyperhidrosis. If the client or patient is a large, burly man with large armpits and axilla, you may need slightly more. If it's a small person, you may need slightly less. So 50 is a commonly injected dose, but you may wish to vary that slightly, 20-30% each way, depending on the person being injected. So let me talk you through the typical equipment trolley that we have set up here for injection of the armpit. First of all, we have this brown solution here, which is 10% povidone iodine, very commonly known as betadine or vidine, which is commonly used to prep the skin prior to surgery. This solution is going to be used to administer an iodine starch test. I will talk to you through the iodine starch test shortly after this. Botox, I'm using Allergan Botox here. We have 100 units, and I have diluted this to 5 mils of bacteriostatic saline. So we have 100 units of Botox in 5 mils of bacteriostatic saline. We have some gauze with which to administer the iodine. This is quite simply corn flour. In this particular case, we have corn flour from Tesco, but any supermarket can be used. The corn flour is basically starch, and the starch reacts with the iodine and creates a pattern that is visible, which will allow you to more precisely inject the affected areas. This device here is a shaker. It can be bought from any typical kitchen store, and this helps just sprinkle the corn flour in small quantities over the area to be tested. We are going to use a 2.5 mil syringe with a 30 gauge yellow needle to administer several little boluses under each armpit, which you will see further on in the video. And this is our typical setup for treatment of underarm hyperhidrosis. So we are now about to perform an iodine starch test. Now, funnily enough, in reality, we do not perform this for every patient that comes for an underarm injection due to the messiness and the time-consuming nature of the test, and the fact that in most cases, if we inject a nice even spread of Botox over the hair-bearing areas of the armpit, we have mostly dealt with the problem. But for sake of completion, we shall be performing an iodine starch test. This helps to sometimes localize the most troublesome areas of sweating, and sometimes people use this test on a second repeat injection if it appears that areas have been missed, and those areas can be identified more precisely. The iodine starch test uses 10% povidone iodine, typically known as betadine or vidine. This solution is painted on to the armpit and left to dry. It is very important to leave the solution to dry. If the solution has corn flour or starch sprinkled on it whilst wet, this will create an inaccurate pattern of darkening, which will lead to inaccurate injecting, as it is artifact caused by the wet armpit. So, to perform this properly, one must paint the iodine on and leave it for a few minutes to dry. Once the armpit is completely dry, there will be a uniform yellow coloration of the armpit, and then the starch can be applied. Once this has been applied, it will take another few minutes for darkening to develop. When the sweating continues to occur with the iodine on the starch, the areas of eccrine glands that are sweating profusely start to create a reaction which causes the areas to become dark. These dark areas then identify those troublesome patches of eccrine glands, and these can be then delineated with a dermal marker, and then accurate injection can take place. So first of all, we're going to thoroughly dry the armpit by using a solution of chlorhexidine in alcohol, or Hydrex solution. This will clean and dry the armpit nice and quickly. What I will now do is just make sure that the armpit is nice and dry. And use a gauze swab soaked with 10% povidone iodine to paint the area under the arm. We'll use the other side of the gauze to mop up any surplus, because it is very staining. And that, as we can see, has now been painted. I'll just do the upper portion just to make sure we are not missing anything. So now that that is on, we shall leave that to dry. So now we will use our starch shaker to lightly apply some starch to the dried iodine area on the armpit. Like so. Can lightly just discard the excess. And now allow for time to show us where the perspiration takes place. So while we're waiting for the other armpit to cook with the iodine starch test, I have currently put the clinic temperature up to 30 degrees, and we are now going to just perform a hyperhidrosis injection on the non-iodine starch tested armpit to illustrate the technique. What you will see is when I start to inject with a 30 gauge needle, my angle of approach is shallow. And the reason for this is because we are not trying to inject the Botox deep. We are trying to inject, ideally, the Botox close to the interface of the skin and the subcutaneous tissue just below it. In fact, if the injection is completely intradermal, that is what we want. The Botox will diffuse to the eccrine glands. We have used a concentration of 5 mils in 100 units this time. That aids a wider diffusion of the Botox, which is what we want in a large area like the armpit. What you should see when the injection is correctly performed is a bleb developing within the skin. So I'm going to now prep this with a little bit of Chlorhex just to clean the armpit, and I will commence the injection. So here we have 2.5 mils of the solution, which contains 50 units of Botox. You see I have gently bent the needle upwards to assist my shallow angle of approach. So I shall now commence. Well done. So what I'm doing is following the hair follicles, the hair-bearing area, and performing a shallow injection over that area. I hope that the camera allows you to see the pattern of blebs. Developing in the areas injected. If we are failing to see these blebs developing, then we know that our injection is too deep. And as a result, we may not get optimal effect in reduction of sweat. So if I was to approximate, you will see that the grid pattern of blebs that is developing is approximately spaced at 1 centimeter intervals. With practice, you will be able to attain a nice, even distribution across the armpit with a good prediction as to the amount that you require for each small bleb. So I hope you can appreciate the grid pattern of blebs that has developed under the armpit, and these will eventually settle. But there we have a completed axillary hyperhidrosis injection, and the blebs will last for a few minutes before resolving. Within a couple of weeks, the sweating should have nicely decreased to a virtually bone dry armpit. Such is the efficacy of this procedure. We have left the starch iodine combination now for a total of about 10 to 15 minutes. What has been illustrated here is that my lovely wife isn't a very sweaty individual, which is probably a good thing, really, but not great for the purposes of the starch iodine. But what I can hopefully prove to you here is that there is a small area of perspiration. Now, if we were treating someone who had a severe primary hyperhidrosis problem, this would be much more extensive. But I hope you can appreciate that there is a positive reaction. And if you refer back to when I was speaking earlier, you will remember that I said if we didn't bother to perform the starch iodine test, we would probably be able to approximate an accurate injection by injecting the hair-bearing areas. And if you look closely, you will see that this pattern of darkness really overlies her hair-bearing axillary. So what we're going to do is mark around the problem area. Obviously, that specific area will be enough to encompass her main issues with sweating. In this case scenario, even though I have injected 50 units on her contralateral axilla, we'd probably be able to quite happily get away with 30 units in effectively less Botox on this side, because we can actually now see that the extent of her sweating is minimal. But alas, I didn't have a very sweaty guinea pig to show you, but we still have managed to show you effectively a positive starch iodine test. We are just going to finish off by injecting the area that was positively marked by the starch iodine test that we've just performed. I have since removed the excess of iodine, and it is obviously quite difficult to remove completely, which is why we do say this test is a little bit messy, but it has enabled us to precisely locate the problem area, if one could indeed call this amount of sweating a problem. But I shall finish off by injecting the affected area. So you'll see the superficial injection technique resulting in these blebs to form again. And like I say, if you're not getting bleb formation, then you're not injecting superficially enough. Keeping approximately a centimeter square pattern between the injection points. And as one can see in this case, the starch iodine test has enabled us to be much more conservative with our use of toxin. We have perhaps injected in the order of 20 units of toxin for this small area here. And that should be enough to switch off the eccrine glands in such a small area. Obviously, if this was a patient with extreme levels of sweating, quite a frank case of primary hyperhidrosis, then we would probably use the whole 50 units, if not more.